Every time you see your feet swell, you might reach for another pillow to elevate them or ignore it until it goes away. But what you're not being told is that those swollen feet could be the first and only sign that your kidneys or heart are struggling, long before pain, shortness of breath, or any classic symptom appears. Doctors often miss it. Families miss it. But you don't have to. Today, we're pulling back the curtain on why swelling happens, the hidden dangers, and what you can do, starting right now, to protect your organs, your independence, and your future. And to everyone listening, I want you to imagine this. You wake up, and as you stand, you feel a gentle pressure in your feet. Maybe see the outline of your socks still indented in your skin. It's not painful, just odd. You think, I'm getting older. This must be normal. But is it? That's what we're here to explore. Dr. Harper, I know you've seen this scenario play out in your practice dozens, if not hundreds of times. Can you explain in simple terms why swelling, especially in our feet and ankles, is so much more than just water weight for seniors?
Susan, you nailed it. Swelling in seniors is one of the most misunderstood and most dangerous signals the body can send. I'll share a story. Just last week, I saw a patient who'd been propping his feet up every night for months. He thought it was normal. When I checked his heart and kidneys, the numbers told a different story. He was in the early stages of heart failure. His feet were trying to tell us what his body couldn't. Here's what happens. When your heart, kidneys, or liver aren't working perfectly, your body starts holding on to extra fluid. Gravity pulls that fluid down to your feet and ankles. What most people miss is that this minor swelling is your body's emergency flare, an early warning, sometimes months or years before bigger symptoms hit. And it's not just anecdote. There's research to back this up. In 2024, a study from Johns Hopkins tracked over 18,000 seniors for 3 years. Those with regular, unexplained swelling in their feet or ankles were more than twice as likely to develop serious heart or kidney trouble within a year compared to those without swelling. The swelling almost always came first.
That's honestly scary, Dr. Harper, because I think about my own dad. He always said it was just the summer heat or too much salt at dinner. And honestly, sometimes I still see it in my own feet and wonder, is this the start of something? What should someone actually look for so we don't ignore the wrong signals?
Great question. The truth is, swelling that comes and goes with a long day isn't usually a crisis. But if you start noticing it more often, if it's worse at night, or if it doesn't go away by morning, that's when you should pay attention. Here's the red flag pattern. Swelling that sticks around, gets progressively worse, or starts creeping up your legs. Add in symptoms like fatigue, breathlessness, or sudden weight gain. Those are all clues your organs are involved. In fact, a massive study out of the European Society of Cardiology in 2023 found that seniors with persistent foot and ankle swelling were 3 times more likely to be diagnosed with undetected heart failure even before classic symptoms like chest pain or shortness of breath appeared.
So this isn't just about comfort or getting shoes that fit better. It's a real physical warning sign. And Dr. Harper, you said something earlier that really stuck with me. Sometimes doctors miss it too. Why does that happen? Shouldn't every doctor be checking for this?
You'd think so, Susan, but here's the hidden truth. In most routine checkups, doctors are rushed. They may ask, any swelling? But unless it's extreme, it gets brushed aside. And most patients, especially seniors, don't want to make a fuss about something that feels minor. Let me share another study, this one from the American Journal of Medicine in 2022. More than 40% of organ failure diagnoses in seniors were missed or delayed because early swelling was ignored or minimized by both doctors and patients. That's why I always tell my patients, you are the expert on your own body. If you notice swelling that's new, persistent, or unexplained, don't just wait. Bring it up and ask for a real answer.
That makes sense. Honestly, sometimes I've felt silly bringing up something like puffy feet when there are so many bigger things going on. But I love that message, be your own advocate. So, what actually happens inside the body to cause the swelling? Can you explain that leak analogy in more detail?
Definitely. Think of your blood vessels as highways for fluid. When your heart can't pump strongly enough or your kidneys can't filter efficiently, fluid starts slipping out of those vessels and pooling in your tissues, especially down at your feet where gravity works against you. It's not about drinking too much water, it's about your body's ability to move and manage that fluid. And in many cases, seniors have silent heart, kidney, or liver issues for months before anything shows up on routine blood tests. But swelling? It's the first clue, and it's right in front of our eyes. A 2023 Mayo Clinic review showed that in seniors with undiagnosed kidney disease, swelling was the very first symptom in 65% of cases.
So, if swelling is really the body's first red flag, what can listeners do right now, tonight or tomorrow morning, to tell if their swelling is normal or something more serious? And is there any simple home check or something to track?
Absolutely, Susan. There's a quick 2-minute press test you can do at home that reveals how serious your swelling might be. And in a minute, I'll walk everyone through exactly how to do it and what to look for. But before we get to that, there's one cause of swelling almost no one talks about, something that can mimic organ trouble, but needs a totally different fix. I'll share that story next.
You've got me on the edge of my seat, Dr. Harper. You said there's a cause of swelling that can look just like heart or kidney trouble, but isn't, and needs a totally different approach. What is it?
Yes, and this is something I see every month. Imagine someone comes in with swollen feet, but their heart and kidney tests are completely normal. What's going on? In a surprising number of seniors, it turns out the swelling is being caused by side effects of common medications or by chronic vein problems, not organ failure at all. Let me share a quick story. I had a patient, Mrs. Landry, in her late 70s. She was terrified she was developing heart failure because her feet were swelling every night. We ran all the usual labs. Her heart, kidneys, and liver looked great. But when I reviewed her medication list, she'd recently started a new blood pressure pill, amlodipine. It's a fantastic medicine, but in up to 30% of older adults, it causes the body to leak fluid into the lower legs. Sure enough, when we switched her to a different med, the swelling disappeared in days. And the other hidden culprit? Chronic venous insufficiency, which means the veins in your legs aren't pushing blood back to your heart as well as they used to. This isn't an organ failure, but it still causes that pooling. And the fix is different. More about leg elevation, compression, and movement, not about treating the heart or kidneys directly.
Wow, I bet that's a huge relief for people to hear. But at the same time, it sounds complicated. How do you tell the difference? Especially if, like Mrs. Landry, you're on medications and not sure what's causing what.
Exactly why we always start with a detailed medication review and a few targeted questions. Here's what you can do at home right now to get a better sense of the cause. The press test. Gently press your thumb into the swollen area on your lower leg for 5 seconds, then release. If a pit or dent remains for more than a few seconds, that's called pitting edema, and it's more likely related to heart, kidney, or liver issues. Check for symmetry. Is the swelling equal in both legs or just one? Symmetrical swelling is more likely to be from organ or medication causes. One-sided swelling often suggests a vein problem or even a blood clot, which is another emergency. Time of day. If swelling is worse at night but improves by morning, that leans toward veins and circulation. Swelling that never goes away or that gets worse every day is more concerning for organ causes. A major 2024 study in The Lancet confirmed that seniors who tracked these 3 clues at home were diagnosed faster and had better outcomes than those who just waited to see or only brought it up at routine checkups.
Dr. Harper, I'm realizing I've never done that press test in my life. And I've definitely had days where my feet looked like little pillows. But if someone does the test and notices a dent or the swelling keeps coming back, what's the next step? Is it straight to the ER or can you wait to call your regular doctor?
I love that you're asking this, Susan, because this is where a lot of people freeze. They're not sure if it's an emergency or just an annoyance. Here's my advice, and it lines up with the latest American Heart Association guidelines from 2023. If you notice swelling plus any of these, shortness of breath, chest pain, sudden weight gain, confusion, or swelling that suddenly worsens over hours, that's an urgent red flag. Call your doctor right away or go to the ER. These are signs your organs may be struggling acutely. If it's mild swelling, you feel otherwise okay, and the press test shows pitting, make an appointment with your regular doctor within a few days. Bring notes about when the swelling started, any new meds, and whether it improves or worsens at different times. And here's the golden script you can use at your doctor's office. Hi, I've noticed new swelling in my feet and ankles. I did the press test at home and found pitting. I haven't changed my diet or activity. Can we please check my heart, kidney, and liver function? A 2022 JAMA Internal Medicine article found that patients who brought clear specific observations and questions were 40% more likely to have their concerns investigated promptly.
That's brilliant. So simple, but most people never think to ask that directly. And I'll be honest, sometimes it feels like the doctor is in a hurry. So I love the idea of showing up prepared with facts. But I want to go back to what you said about medications, because that's a big one for seniors. What are the most common drugs that cause swelling? And are there ways to get the benefits without the side effects?
Yes, this is crucial. Medications like calcium channel blockers for blood pressure, some diabetes drugs, certain steroids, and even over-the-counter NSAIDs like ibuprofen can all cause swelling. The good news is, for almost every medication that causes swelling, there's an alternative or an adjustment that can help. Here's where open communication with your doctor is everything. Don't ever stop a prescribed medicine without talking to your provider. But if you notice swelling after starting something new, bring it up right away. Sometimes it's as simple as lowering the dose or switching brands. And for vein-related swelling, regular walking, using compression stockings, and elevating your legs for 20 minutes a few times a day can make a huge difference. A 2024 Cochrane review showed that seniors who did gentle leg exercises and used compression saw their swelling and discomfort drop by over 50% within 2 weeks.
So what I'm hearing is there are actually practical fixes for most kinds of swelling, but you have to know which kind you're dealing with, and you have to speak up for yourself. But here's what I'm dying to know, Dr. Harper. Sometimes, even after all the usual suspects have been checked, someone's swelling just won't go away. What then? Are there hidden conditions or lifestyle changes that really work? And what's the one mistake that keeps most seniors from getting the right answer?
Those are great questions, Susan. And yes, sometimes persistent swelling means looking deeper at things like undiagnosed sleep apnea, diet choices you'd never suspect, or even hormonal issues that doctors miss. In our next segment, I'll walk you through the 3 hidden causes of swelling most doctors overlook, the lifestyle tweaks that make the biggest difference, and a case story of a patient who cracked the code when everyone else gave up. Plus, I'll share the surprising blood test that finally got to the bottom of a mystery swelling case and what every senior should ask for during their next checkup.
You've got me, and I think everyone listening hooked. Dr. Harper, you're saying sometimes swelling lingers even after all the usual suspects have been checked. What are these hidden causes? And what's the most common mistake seniors make that keeps them from finding answers?
Let me start with the mistake. Most people, and even doctors, stop looking after the first round of basic tests. If it's not heart, not kidneys, not liver, the assumption is it's just aging. But there are at least 3 hidden causes we see more often than you'd think. The first is undiagnosed sleep apnea. It sounds unrelated, but when you stop breathing at night, your body struggles to balance fluid and salt. I had a patient, Mr. Rodriguez, whose feet were so swollen by morning he couldn't wear shoes. His labs were normal until we did a sleep study. Treating his apnea cut his swelling in half in 2 weeks. A 2023 study in chest found untreated sleep apnea doubles the risk of unexplained edema in seniors. The second is hidden dietary salt, not just from the salt shaker, but from processed foods, canned soups, deli meats, and even healthy frozen dinners. A major CDC analysis in 2024 found that 65% of sodium in a senior's diet comes from hidden sources. Even a small excess can overwhelm aging kidneys, leading to stubborn swelling. And the third is hormonal changes, especially in women. As estrogen drops, fluid balance shifts. Even thyroid issues. An underactive thyroid can quietly cause swelling, fatigue, and weight gain that seem just part of getting older. In fact, a 2022 Endocrine Society report showed 1 in 8 seniors with chronic swelling had low thyroid hormones missed on standard labs.
That explains so much. I actually have a friend who tried everything, changed her diet, switched her meds, even wore compression socks every day. Turned out it was her thyroid, but nobody thought to check until a year later. It's easy to feel lost or brushed aside.
That's why I always tell my patients, if you have swelling that just won't quit, ask your doctor for a sleep study, a detailed thyroid panel, and a close look at your diet. Don't settle for just getting older. And here's a tip straight from recent research. If your doctor isn't sure, request a test called NT-proBNP. It's a simple blood test that screens for early heart strain, even before classic symptoms appear. In a 2023 study published in the New England Journal of Medicine, adding this test for seniors with unexplained swelling led to faster diagnoses and better outcomes, reducing hospitalizations by 23%.
This is so empowering, Dr. Harper. I hope everyone listening hears this. Don't stop at the first normal test. Keep asking. But let's pivot for a second to what people can actually do at home every day to lower their risk. What are the biggest lifestyle tweaks that work?
Great point. Here's are the game changers, and they're all backed by real studies. Movement, even gentle activity, walking, ankle circles, leg stretches, keeps your blood moving and reduces swelling. A Stanford study in 2024 found that seniors who did 15 minutes of movement 3 times a day cut leg swelling by up to 45%. Salt awareness. Read labels on packaged foods, aimed for less than 1,500 milligrams of sodium daily. Swap canned soups for homemade, choose unsalted nuts, and avoid deli meats where possible. Leg elevation. Prop your feet up above heart level for 20-30 minutes twice daily. Hydration. Drink enough water. It sounds counterintuitive, but mild dehydration can make swelling worse by signaling your body to hold on to fluid. Compression gear. If recommended by your doctor, compression socks can help veins push fluid back toward your heart. And don't forget regular weight checks. Rapid weight gain, more than 2 pounds overnight or 5 pounds in a week, can signal fluid buildup from organ trouble, not just food or exercise changes.
That tip about movement makes so much sense. I notice when I'm more active, my feet look and feel better. And I never realized how much salt is hidden in so-called healthy foods. Dr. Harper, what about talking with your doctor? A lot of seniors, myself included, sometimes feel rushed or like we're just being a bother. How can listeners make sure their concerns get heard and their swelling is taken seriously?
This is such a common and important issue. Here's my advice. Be specific. Bring a notebook to your visit. Write down when the swelling started, what makes it better or worse, and any changes in meds or diet. Describe patterns. My swelling is worse at night, goes down in the morning, and started after a medication change. Ask direct questions. Could this be related to my heart, kidneys, or a medication?
Use the press test. Show your doctor if there's pitting. Request key tests. NT-proBNP, full thyroid panel, kidney function. A 2024 survey in Patient Experience Journal showed that patients who came with notes and direct questions were twice as likely to have their swelling fully investigated and explained. And if you feel dismissed, it's okay to ask for a second opinion. You deserve answers.
That's powerful. It really is about being your own advocate and having the confidence to speak up, even when you feel nervous. Dr. Harper, before we wrap up, what would you say to someone listening right now? Maybe they see swelling in their own feet, maybe in a parent or spouse, and they're not sure what to do next. What's the first step they should take tonight?
Start simple. Tonight, do the press test. Check for pitting. Make a note of when you see swelling and how it changes over 24 hours. Look at your medications and think back on any changes in your routine. If you're worried, don't wait for your next yearly checkup. Call your doctor, bring your notes, and ask the direct questions we talked about today. The sooner you act, the more options you have, and the more likely you are to catch a problem early, while it's most treatable.
That's exactly what I hope everyone takes away from this episode. Swelling isn't just about comfort or looks. It's a real, meaningful message from your body. Listen to it, trust yourself, and take action. You're not alone, and there are answers. Dr. Harper, thank you so much for sharing your stories, research, and practical steps. I feel more prepared, and I hope our listeners do too. And don't miss next week's episode, where we'll uncover the hidden signs of bone loss every senior needs to know, including the subtle symptoms that could save you from a fall or fracture. Until then, take care of your feet, your organs, and each other. This is Susan Miller with Dr. David Harper, wishing you a healthy, empowered week.